This presentation will document the journey of a social care practitioner through the professional journey, their career development and professional identity. The presentation will demonstrate challenges faced by the professional during the course of their work and how they've overcome these challenges. I will introduce the practitioner, their professional journey to date, their additional networks and challenges that have faced them. I will also demonstrate relevant theory through the professional journey and examples of how they experienced it during their practice. The final part of this presentation will discuss the importance of self-care for the practitioner, and if they were to go back in time, what would they have liked to have learned in college that was not available during their social care degree. The practitioner interviewed is a 37-year-old female who has worked in the area of social care for 10 years. To date, she has achieved a BTEC Level 5 in childcare, an undergraduate degree in social care, Masters by Research in Social Care around the area of disability, part-time courses in community development and addiction studies, and she is currently doing her PhD in the School of Nursing and Midwifery in Trinity College, Dublin. The practitioner interviewed was an early school leaver. She stated that she had life experience, but very little work experience, and this is what drove her to go back to education. When working in the area of community development, the practitioner applied for a job in addiction, and to her disbelief, she received this job. She had then realised that although she wanted to make a change in the sector, it was difficult to do for one person alone. When the interviewee first started her job in addiction, the first thing she did was look up every agency that was funded by the Drug Task Force and phone them up. This allowed her to network with other agencies and resulted in her being able to work together with some of these agencies. These services were also places she was referring her clients to, and it's important she had a good relationship with them also. Some of these networks were the Homeless Substance Misuse, Psychosocial Services and White Oaks Rehab. The practitioner stated her job in addiction challenged her most. She found it extremely hard to leave work at the door. She was an advocate in her community and was very passionate about her job and helping others. The practitioner also explained that it was common to see her clients or their families out and about, and the most awkward situation for her would be seeing a client at a bar. She would be drinking alcohol, which is perfectly fine. However, she described that she would have been cautious about the amount of alcohol she would have drank in these situations due to the nature of her work. Due relationships are problematic because some due relationships are clearly exploitative and do serious harm to the helper and the professional involved, while others do not cause harm. Due relationships are not always obvious. It can be difficult to anticipate situations where there are not currently conflicts in role, but may become so at a later time. The practitioner interviewed explained there was one occasion during her addiction job when she got a call from a client who asked to meet her in a coffee shop. She had not previously met this client. However, he turned out to be a neighbour of hers. As addiction is a very private thing, she asked the client would he like to be referred somewhere else. However, the client was happy to stick with her and they are both decided they are comfortable to work together. Vicarious trauma is defined as a transformation in the helper's inner sense of identity and existence that results from utilising controlled empathy when listening to clients' trauma content narratives. In other words, vicarious trauma is what happens to your cognitive, physical, psychological, emotional and spiritual health when you listen to traumatic stories day after day. The practitioner interviewed stated there was an incident when working in addiction that a client had called her and told her he was suicidal. On occasion he would disappear without telling anyone and spend his days drinking. The practitioner spent hours on the phone trying to locate her client. She said this was the most challenging incident that ever occurred in her career, as she felt a huge amount of responsibility and had very little experience in suicide prevention at the time. Professional identity is an emerging research area that has developed over the last 10 years. It can be defined as an individual's self-definition as a member of a profession and is associated with the attachment of a professional role. The practitioner interviewed described an incident when she and her daughter were walking home one day and a group of heroin addicts tried to talk to her. The practitioner stated that she had to immediately put boundaries in place as she was with her daughter and didn't want to put her in an uncomfortable situation as the addicts were under the influence of drugs. The practitioner later said that if her daughter was not with her, then she would have stopped and spoke to these drug addicts. She emphasised that she is a normal person outside her job and cannot always wear her professional hat. However, this did take her a long time to be like this. Threshold concepts builds on a notion that there are certain concepts or certain learning experiences which resemble passing through a portal from which a new perspective opens up, allowing things formerly not perceived to come into view. There are 4 key features: transformative, integrative, troublesome and bounded. The practitioner interviewed said working in the sector has had positive influences on the way she sees things. It has made her realise how lucky she is and how she should not take things for granted. However, having said that, the practitioner also stated she has viewed negative influences on the way she sees working in the sector. She has realised that certain groups of people are very oppressed and they are treated differently because of their social class or the position in life in which they find themselves in. Rural communities often have a limited pool of healthcare and mental health providers. In rural or small towns, the possibility of simultaneous personal and professional involvement is high, if not inevitable. The practitioner interviewed stated that she had always worked in the rural areas of Ireland, but had never had much issues regarding this. The practitioner said she was well known for her position in the community and was just seen as this figure. Evidence-based practice means using the best research-proven assessments and treatments in our day-to-day client care and service delivery. This means clientician undertakes to stay in touch with the research literature and to use it as part of their clinical decision-making. It was important the practitioner interviewed to understand evidence-based practice as part of her role while working in the area of addiction, in order to link in with and work alongside her clients. Self-care is any activity that you do voluntarily which help you maintain your mental, emotional, physical health. It can help you feel healthy, relaxed and ready to take on your working responsibilities. The practitioner interviewed has put methods in place for her own self-care, such as walking home from work each day to clear her head. She stated it took time to put methods for herself in place, as her work had a high rate of burnout and different responsibilities. It was necessary. When I asked the practitioner what she would like to have learned if she went back to college while studying her social care degree, she said she would have liked more around the area of assertiveness. She was not very assertive at the beginning of her career. She also stated that she would have liked more around suicide awareness and mental health, and would have liked every theory learned to then be made practical in order for us to develop as social care practitioners.